I'm Peter Block at TCT 2018. With me is Daniel Dijsch from the Netherlands. And this is about the Syntaxes trial. Now, you know, one of the things, Daniel, that really makes me sort of shiver is that it's already 10 years. And that 10 years really went by quickly. So this is now 10-year follow-up of the Syntaxes.
Yeah,
awesome long-term follow-up of a very important trial. Tell me where you stand with this trial. Tell me the number of patients that you currently have data for and what the outcomes are.
We have currently data of 1,301 patients, which is 72% of the total data. We're collecting the remaining patients, the survival data at least. And the main outcome is that in the overall cohort, CABG and PCI performed actually pretty good. There are similar survivals at 10-year follow-up. However, if you look in the 3-vessel disease patients, you see that the CABG provides a significant survival benefit over PCI. Yet, in the left main disease patients, we see that the survival lines are almost equal between CABG and PCI, and they have equal survival follow-up.
Well, that's good news.
Years.
That's good news for the interventional group,
exactly,
isn't it?
Yeah.
Yeah. So as far as the surgical group is concerned, the surgical group has always interested me because the original trials way back in the early 80s seemed to show that surgery was really good for 3-vessel disease, particularly if the ventricle was not good. Do you have any information on ventricular function in the Syntaxes trial?
Actually, we have. Yeah, we have the same patients as as we started 10 years ago, over 10 years ago. I'm sorry, I don't know the left ventricular status by head,
okay.
but we know that in patients with 3-vessel disease, they have a slightly higher Syntax score. So the complexity of the coronary artery disease is higher, and that's why we think CABG provides.
Yeah, well, I think complexity of disease always makes a difference, doesn't it?
Exactly.
And we chatted about this before we started the interview. Exactly why that may be the case is not entirely clear, but certainly surgery provides excellent inflow, doesn't it?
Correct. Yeah, it does. Yeah.
So there's something magic about inflow that seems to make a difference to the coronary circulation.
It might be, but if you look into the left main patients, which most of the time have a focal lesion at the beginning of the ostium of the LAD or the CX. And you can see that if you do a PCI very well, that the patients will survive a 10-year follow-up equally to the CABG. So I think the complexity of the disease indeed, and maybe a little bit magic.
I think there's a little bit of magic, but that's always good.
Exactly.
In any case, you're going to continue to get 100%, you hope, follow-up, and maybe at one of the big meetings in the next year, we'll see 100% follow-up with this 10-year follow-up. But for now, actually not unexpected. Is that fair, Daniel, to say follow-up at 10 years?
I think fairly unexpected. However, although everybody thought at 5 years, when you look at the curves which have been reported in the Lancet, and you look at the all-cause mortality, you see the curve slightly diverging. So you could have expected as well that there will be a difference at 10 years in the overall group.
But that is
However,
not
that's not the case. So compared to the current guidelines, we see that that it's a good result.
And it's still a good idea to look at the Syntax score of a patient before you decide what you want to do with them.
I think everybody should do that, especially in the heart team discussion. You look at the Syntax score, you look at the baseline characteristics of the patient, and then you should choose for the correct revascularization strategy.
Okay, 10-year follow-up of Syntaxes, long time and excellent data ongoing. Thank you very much, Daniel.
Thank you very much.